Hello, this is Siddharth Dambar from Chicago Arthritis and Regenerative Medicine. Welcome to our weekly live broadcast. It's October 7th, 2020. Thank you for everyone's time, and I hope everyone's doing well. So on this broadcast, I discuss concepts that are important with what we do here at Chicago Arthritis and Regenerative Medicine, where we specialize in evaluation and management with non-surgical options for arthritis, tendinitis, injuries, and back pain. So interesting study that came out recently that I think really exemplifies a lot of what regenerative medicine is about is an article that came out from Korea in the BMC Musculoskelet Disorders journal, where they essentially looked at what does it mean to really have advanced osteoarthritis in the knee. So they looked at 3 large national databases in South Korea. They had a total of 20,000 people, and roughly 10% of them had advanced knee osteoarthritis on Xray. That's probably to be expected in a large enough cohort of people that 10% of them would have KL4 degree osteoarthritis. And what they found was that up to 30% of them were asymptomatic without any symptoms of pain or loss of function that they were describing due to their knee arthritis. That's interesting because, for physicians, we frequently talk about how you should treat the patient and not treat the image. And yet, it's very frequent when it comes to musculoskeletal medicine that people will look at someone's knee X-ray and will tell them, well, you actually have bone-on-bone knee arthritis, and you should consider knee replacement surgery. And that's regardless of how significant their pain is, their dysfunction is, or if they've even failed other treatment options. And so that concept of treat the patient and not the image is really exemplified here, because just having severe osteoarthritis on the X-ray did not necessarily mean that you're going to have really significant pain. And in this article, they have this last line where they say treatment options focusing solely on cartilage engineering should be viewed with caution. It's a really great line because there is a developing industry in orthopedics that's based on actually trying to repair small cartilage lesions. The idea being that a person's pain is coming from the amount of cartilage damage, as opposed to the stress on the bone or the other soft tissue structures. And this is a great study because that even when you have someone that has advanced arthritis of the knee, that's someone who can still respond very well with a regenerative medicine approach to treatment. In fact, the evidence out there shows that the degree of arthritis in the knee does not make a difference when it comes to utilizing your own bone marrow-derived stem cells when it comes to treating that knee arthritis. On the other end, platelet-rich plasma sometimes can be worse and not as effective in someone who has more advanced arthritis, but your own bone marrow cells definitely can still be helpful. So, and part of that comes from an understanding of how regenerative medicine works. Meaning, number one, you want to treat all the pain generators. It's not just looking at how much cartilage wear there is, but it's also what else is going on in that joint. Is there any degree of chronic inflammation? Is there any sort of chronic stress on soft tissue structures, meniscus, ligaments, tendons? Is there any sort of nerve or muscle related issues? How can you maximize not only the cellular health within the joint, how can you reduce chronic inflammation? How can you improve stability of the joint by improving those soft tissue structures as well? And really improving the overall joint and what's driving pain. Understanding that a degenerative process in a knee is not just how much wear there is on the cartilage that you see on an X-ray or an MRI, but really it's the entire structure that's pathologic, and how do you actually make that whole structure better. And the last part of that is understanding that there's layers of pathology in someone that's got degenerative arthritis of the knee, and you need to address all those layers. And so a classic mistake that I see from physicians who dabble in regenerative medicine is that when it comes to treating an arthritic joint, they'll only inject cells into the joint. They don't actually treat the whole structure, meaning all those other soft tissue structures and those layers and layers of pathology. It can make a big difference from someone who has a average or even mediocre result from treatment to someone who has a really great result to treatment. That understanding that it's not just what does an X-ray look like on the knee, but treating that whole structure and the whole patient as well. And so understanding that you treat the patient and not the image is something that I think for everyone out there, it's important to understand that, because even if your physician says that and believes that, a lot of times their actions don't necessarily showcase that. And a proper regenerative medicine expert really understands that and will do a better job of treating the whole structure, the whole joint, to give you pain relief and functional improvement. Great. Well, I hope that clarifies some understanding of bone-on-bone arthritis that's described on X-rays frequently. As a reminder, we do this on Mondays and Wednesdays. In addition, I'm doing a webinar today, 5 p.m. Central Standard Time, on regenerative medicine treatments for the knee. If you're interested, you'll see a link attached to this video. And until next time, have a good day and live well. Bye-bye.